Policy Matters is a series from the Regional and Community Outreach Research Team at the Boston Fed, using data to illustrate the real or potential implications of policy for promoting equitable outcomes and economic security in New England and across the United States. The coronavirus pandemic has highlighted both the importance of paid sick leave for promoting public health and maintaining a healthy economy, and the startling absence of any federal paid sick leave policy. Paid sick leave includes paid or earned sick hours or days that workers can take off from work to address short-term healthcare or preventative care needs for themselves or, sometimes, their family members, without fear of losing wages, benefits, or employment. It is often earned based on hours worked. Before 2020, there was no federal requirement that private sector employers provide their employees with paid sick leave. For most workers, their employers decided whether or not they would have this benefit and how much paid sick time workers had access to. Since the start of the pandemic, we have seen clearly why paid sick leave is essential to protect public health. But it's also important in ordinary circumstances. Without it, workers may be forced to go to work while sick and even while contagious, so that they don't lose vital paid hours or lose a job completely, risking personal and family financial peril. Paid sick leave protects public health and productivity by helping to maintain a healthy workforce. The Families First Coronavirus Response Act, or FFCRA, the first pandemic relief package, passed in March 2020. It required firms with 500 or fewer employees to provide paid sick leave to all employees for COVID-related reasons. I asked how much paid sick leave coverage might have increased because of FFCRA, and if by requiring broad-based coverage, FFCRA might have increased equity in access to paid sick leave. Although there was no federal paid sick leave law in place before the pandemic, we should note that several states and some cities passed laws requiring private sector employers to give workers paid sick leave. The terms vary from one state to another, but full-time workers in these states tend to get around a week of paid time off per year. As you can see, many of these states are in the Northeast. I focused this analysis on the Northeast region, which includes the 6 New England states, plus New York, New Jersey, and Pennsylvania. Currently, 7 of these 9 states have a paid sick leave law on the books. New Hampshire and Pennsylvania don't. The first universal state paid sick leave law in the region was passed in 2015 in Massachusetts. In order to hypothesize how the FFCRA might change rates of access to paid sick leave, I looked at this region in the 5 years before Massachusetts' paid sick leave law was in place, 2010 to 2014. During this period, Connecticut had paid sick leave in place for service workers only, and no other state had any paid sick leave legislation in place. I used publicly available data from the National Health Interview Survey, a survey on health, healthcare, and related issues that the CDC administers yearly. This survey asks all respondents who have some work history if they had paid sick leave in their main job, or in the job they held the longest, or in the job they held most recently. While close to 6 out of 10 adults with some work history had paid sick leave, certain subgroups of workers had this benefit at much lower rates. For example, among those from families with income below the federal poverty line, only 1 in 4 had paid sick leave with their job. Hispanic workers also saw lower rates of access to this benefit. 6 out of 10 workers had paid sick leave, but only 5 out of 10 Hispanic workers had it. I then asked who would have paid sick leave if FFCRA were in place. I learned that had FFCRA been in effect before state policies, close to 95% of workers in the Northeast would have been covered, and access for workers across groups became fairly similar with FFCRA enacted. FFCRA was a nearly universal policy, though some exemptions, most notably of those working for large businesses, exist. It evened out the distribution of paid sick leave benefits, so that workers who were much less likely to have it before ended up having it at similar rates as everyone else. It is, therefore, an example of how thoughtful and well-implemented universal policies can play an important role in creating equity within the labor market.